remember thinking as soon as I started hormones that I was going to have this amazing beard and this really great mustache, and I was going to be walking around looking like I work at a coffee shop the rest of my life, you know? But no, that's not how it happened. Hi, thank you for listening to Free My Pride podcast. I'm Greyson, one of the hosts, and today we're doing things a bit different here. I recently tested positive for COVID-19, so we are going to be recording from separate locations. We probably could have went ahead and did a video call or something and recorded together, but we thought it might be interesting to kind of split up the topics and cover more ground that way. So we will have different topics that we're talking about, and but you will hear from both of us today. Just tune in, and Bren will be on here shortly if that's who you're here for. But thank you for listening. Hi, I'm Greyson, and today I'm going to be talking about my transition. So basically what I'll be covering is when I started hormones, how I got started, how long I've been on them, and how long it took to see results, as well as any surgeries that I've had, how much they costed, and what the recovery process was like. So I will be doing as much detail, or I will be going into as much detail as I possibly can. I am only recording for about 30 minutes or so, so if I don't cover something that you may be interested in, go ahead and message our accounts or, reach out to us in some way, and maybe we could do a podcast on it, answering the questions, or, maybe we could just directly answer your question if we know it. It's important to keep in mind that I'm not a medical professional, so if you're looking for medical answers, I would talk to your doctor. So I'll just go ahead and get into it. And bear with me because I'm still kind of sick. My name is Greyson. That is my legal name. I changed it legally a little over 2 years ago, but I'm pretty sure I've been named Greyson for 3 years now, or living by the name Greyson for about 3 years. I'm a trans man, so I just go by male, but I guess if you want to get technical, I am a transgender male, which means I was assigned female at birth, and then I have transitioned into a male. I started testosterone in early 2019, so I have been on hormones for about 4 years. So to break down how I got started on hormones, it was a really lengthy process. So for people who are really impatient like myself, it's going to be very tedious. You first have to go to your doctor, you have to get a physical, you have to get checked out and everything, and then you have to see a counselor or a psychiatrist. I had to see a psychiatrist at the beginning, and I had to attend several sessions with them and get a note of recommendation that I could give to a healthcare provider to basically be prescribed testosterone. So I initially started on the gel form of testosterone. And if you don't know, there's multiple different ways of taking testosterone. There is injections, gel, and then there's a pill form. But the pill has to it's not like a pill that you kind of take. It's more of like one that they do like I guess they do like a cut into your skin and then insert the pill, and then it just like slowly dissolves. It's not like an oral pill that you take. God, I wish it was though, because I really hate doing the injections, which is what I switched to after about 4 or 5 months. I switched to injections because with the gel form, I just wasn't seeing the results very quickly, and a lot of other people that I had talked to that were on the injections had started seeing results within 2-3 months of starting hormones, whereas I had been on them for about 4 or 5 months and I hadn't seen really any results, and I guess I was just getting impatient and frustrated. So I would recommend to anybody who is starting hormones like personally, I recommended to one of my buddies. I said, look, when you start hormones, you're going to want to see results quick, so I would start with injections. But if you're not good with needles, then they do have alternative forms of testosterone, so you're in luck. I know a lot of people eventually, after being on injections for so long, they're like, man, I really want to stop stabbing myself, so I'm going to go ahead and switch over to gel, which is completely fine. After I started hormones with the injection form, I almost immediately started noticing results. To start off, like the first result that I really started to notice was my voice lowering. The facial hair and body hair, it does not happen nearly as fast as people think. I remember thinking as soon as I started hormones that I was going to have this amazing beard and this really great mustache, and I was going to be walking around looking like I work at a coffee shop the rest of my life, But no, that's not how it happened. I didn't really start to notice a lot of results until like the second year that I was on hormones. Even now, like, I don't really have that great of a mustache. The beard grows pretty quick and pretty nicely. It still looks a little weird without a mustache. I keep it all trimmed down pretty short, or I try to. It takes time to come in, and it's still starting, like, patches are still starting to form, so I'm still excited about it, but it didn't happen nearly as quick as I would have preferred. Yeah, that was sort of the first couple results that I noticed happening. And then I guess your body starts to change. When I first started hormones, I think I was wearing like a size 9.5 shoe size, and I actually didn't notice this until recently, and I was like trying to go through some of my old shoes, and they were all 9.5, but I wear 10 now, which is weird to think about, that my feet grew. But now I can't wear any of my old shoes, and it kind of sucks, but it's okay. I got all new shoes now, so I guess another sort of like body change that you start to notice is like, I guess the fat on your body starts to move. Like if you carried a lot of fat in your hips or your thighs and stuff, it starts to shift upwards and go more towards your gut. So you get more of like a rounded belly look, or if you had a lot of fat in your like upper arms or whatever, it starts to move more towards your middle section, I guess. That's always something to look forward to. It's less evenly distributed out through your body. And then your muscles start to shift as well. You start to be able to put on more muscle mass in your arms and your chest and stuff. I noticed it was a lot easier to start working on my chest and biceps and stuff. Now, I don't work out a lot, so I probably don't see as many results as I probably could have, but a lot of other trans guys that I've talked to have, they work out and stuff, so they're like, yeah, I put on a lot of muscle and shit, and I'm like, good for you, bud. I'm not really there yet, but it's nice to know I could. So my dosage is 0.4 milliliters of testosterone that I inject once a week. Now, oftentimes, like when people start getting prescribed hormones, they have to constantly readjust. And I remember before I started hormones that this is one of my, like, this was what I kind of freaked out about the most, is I was like, I'm going to, be off, and I'm going to not get this right. And, a lot of that stuff you don't really have to worry about, because your doctor is the one that's going to be figuring it out for you the most. So if you have any anxieties there, if you're listening to this and you're thinking about starting hormones, if you have any anxieties there, don't panic. If you have a doctor that is experienced with transgender patients, then they should know how to adjust your hormones just right for you. Actually, a lot of it you kind of figure out for yourself as well, on what feels the best for you. I remember when I first started hormones, I had to keep upping the dose, because I would get a little bit tired by the end of the week. So we had to adjust the prescription like slowly up to get it to the point where, by the end of the week, I wasn't kind of like depleting in energy, because my hormones would fluctuate so much. What I found works best for me is 0.4 milliliters, and I inject once a week. Another thing I would also recommend is making sure that you're injecting those hormones at the same time every week. Like if you're doing it on a Monday, if you first start on a Monday, make sure you're hitting that mark every Monday. Like leave a note for yourself and stuff. I feel like kind of a hypocrite saying that because I miss my shot a lot. I don't miss it for the week, but I miss doing it on that exact date that I started doing it, so I have to readjust the times that I'm doing it, and I'm like, oh man, I think I did it last week on a Thursday, and so I got to make sure I do it next week on a Thursday, and I almost never do it on that date. So I would just recommend trying to do it around the same time, just so that your hormones stay as balanced as you can get them to be. As far as that goes, that's about what I know about testosterone. So I guess to get into the surgeries a little bit. So I think it was about 3 years ago, and maybe 1 year into my hormones, that I had top surgery. Now, you don't have to even have started hormones to get top surgery. So if hormones aren't something that you're looking for, don't even worry about it. You can still go ahead and get top surgery. However, with top surgery, it is similar to hormones, where you have to, basically jump through hoops. Mine took a while to go ahead and get approved. And I've talked to a lot of trans guys, and they've also had to wait a while to go ahead and get approved for that as well. A lot of it has to do with the surgeon as well, with what times work for them and if they're really booked up and stuff. I remember that my surgeon was pretty much booked out through the rest of the year, but we were able to get a date in there. To get approved for the surgery, you have to get two letters of recommendation from two different psychiatrists. So I met with the current one that I had been seeing, and then another one, so that I could get my top surgery approved. I'm not sure that it's like that for every single state. I think every state has like kind of a different process for that. Maybe some don't require the letters at all, and maybe some require 3 or 4, but for Indy, that was what was required of me at the time. And I realize now that, especially depending on ages and stuff, that things are kind of readjusting, and they're different. Recovery from the top surgery was, I guess, the best way to describe it was inconvenient. They always tell you, like, after you get top surgery that you're basically gonna have T-Rex arms, which is the best way to describe it, because your range of motion is like limited to none. You won't be able to lift your arms up. You won't be able to like really reach up high or really stretch them out very far width-wise either. They're pretty much gonna remain at like both sides of your body for probably about a month, to be honest, maybe even longer, depending on how you recover. Mine was about a month, maybe a little bit longer than that. I tried my best to like not reach, because the more you reach up, the worse the scars will heal, the more they'll stretch, the more they'll like kind of pull at your wound. The best thing that you can do is just kind of try and relax and not do too much. I remember for everybody else it kind of sucked too, because the whole month, and it happened actually, I got mine in November, like late November, so like early December, and throughout the whole month of December I was just kind of on the couch the whole time. So, Christmas was a little weird, but the actual recovery wasn't too bad. It wasn't super painful. I was prescribed, I think hydrocodone, and I didn't even really end up needing to take more than like 1 or 2 of those after recovery. So it was mostly just ibuprofen and Tylenol, but the actual recovery process wasn't bad. It was 100% worth it. I remember when I woke up, I was like, oh my god, is this even real? Like, it really helps alleviate more dysphoria than people would think. Yeah, I would definitely recommend if you're like thinking about it and you're like, oh, I don't know that would be worth it. It is. So I guess the part that people really get hung up on, and the main reason that people who are trans don't really get to get the surgeries that they're looking for, is the cost. So I guess to discuss the cost a little bit, so on average, top surgeries without insurance range around I think it's like 6,000 to 10,000, which it's big numbers, But with insurance, it's gonna sound unbearable. But like I said, it's with insurance, so you know how hospitals always jack up the prices. I think mine costed around 65 grand, but out of pocket we only had to pay roughly 5 grand of that, so a little less than what was estimated without insurance. A lot of the cost variation has a lot to do with what surgeon you're having do the surgery, and then what surgery that you are opting for. So keyhole, since it's so kind of a tedious surgery, it's like I know that it lasts longer. It's a lot more difficult. It's usually on the higher range, and then double incision is it's usually on the lower. And it really just depends on what hospital you go to and what surgeon is performing it. But I know that my surgeon was a little bit more expensive because she did the drain free. I think that maybe that added into the cost a little bit, as well as what the hospital charged, and the patient care and everything else. But the experience with the hospital was great. I had like a first in the very beginning of the morning surgery, so I was obviously super nervous, but I was also kind of tired, so I guess that helped out a little bit with like trying to feel a bit more comfortable. The surgeon, she performs mostly just on trans patients, so it was like easy for her to just kind of know how to come in there and make me feel super comfortable about the entire process, because for a lot of trans patients, like the entire process is really uncomfortable from start to finish. So it's not until after that they really feel at the most comfortable. But everybody in the hospital tried their very best to make the process as easy for me and them as possible. So I would say 100% would recommend that doctor, but she's not here in the state anymore, so I guess if you're in Florida. Her name is Dr. Gallagher. She has her own practice there now. If you're in Florida, go ahead and check her out. And she performs I think she performs top and bottom surgery on male to females, and then I'm not sure that she performs bottom surgeries on female to male, but she does perform top surgery, both double incision and keyhole, so she's great. Would definitely recommend her. More recently, actually just in the past 6 months, I had a histo, and so recovery from that one was 100 times easier, honestly. I was not limited in range of motion or anything like that. You still have to be careful about lifting any sort of weight and stuff, and kind of take it easy for a while, but the actual recovery process, it's not like you had an open wound that you were kind of tending to, so it went relatively smooth. I mainly just got that surgery as for in the future, when or if I do decide to go ahead and get bottom surgery, that there are a couple different types of bottom surgeries that female male trans people can get. They offer, it's called metoyoplasty, and then there's phalloplasty, and I'm not going to go into too much detail today on what the difference in those ones are. I'm not 100% sure on which ones I would prefer yet, so I'm leaving my options open, but I wanted to go ahead and get the histo out of the way, because I know that is something that I would want to be done with before even going in to surgery. So yeah, as I had said before, recovery for the histo was actually pretty good, pretty easy. You will have some swelling, some pain. Yeah, I don't even think I needed to take any of the pain meds that they had originally given me. I try to stay off of those ones just because the side effects aren't great for me. I get itchy for some reason, and I just feel really hot when I take those, really hot and itchy, and so I just usually stick with Tylenol or ibuprofen, and honestly it helps a lot with the swelling as well. So after the surgery, just be kind of swollen and bloated and kind of feel gross, but recovery is a lot easier for that one than it was for the top surgery. Not that the top surgery was too bad, but it was definitely more inconvenient than the histo. So I guess talking about pricing of the histo, it's a bit more of a routine surgery for both, female to male trans patients, and then just female patients. It's pretty routine. Mine costed about, with insurance, I think it came out to a total of $44,000, which out of pocket we only had to pay about $1,400, which was really nice. But without insurance, it's similar to the price of top surgery, ranging around $5,000 to $10,000. Once again, just depending on who does the surgery, what sort of surgery, and if there is any complications. I know sometimes, depending on the reason as to why somebody's getting the surgery, can depend on the price of the surgery. So if they know going into it that there will be complications, then 9 times out of 10 it'll be a bit more pricey. One thing I will say about the surgery that's kind of weird is just that your belly button will be sore after for a while, because a lot of surgeons nowadays use laparoscopic, which means they go in through your belly button, and that'll create some soreness around it. It won't be unbearable or anything like that, but I guess I didn't really expect it going into it, but I understand now. I had that surgery through IU Health, and the surgeon was super nice, super great, and then all of the nurses seemed really nice. I guess afterwards was kind of the weird part, because I remember coming out of the surgery and I was in this this waiting room where they were like, there was a bunch of other patients around me as well, and I was just waiting to I guess I was just waiting there until I kind of woke up out of this weird state of the anesthesia was wearing off, and that was when I was most sore. And I was trying to communicate with this nurse hey, I'm not feeling good, man. And I remember him just being like, dude, you need to wake up. I can't give you any pain meds until you wake up. And I just remember spilling water on myself. Everything went pretty smooth after that. Surgery was pretty easy, and if you're thinking about, and I think that for phalloplasty that the hysterectomy is required, but for metoioplasty I think it's optional. So if you are considering doing phalloplasty, then that will unfortunately be something that you will have to have done beforehand. Either that, or I don't know if the surgeon might offer it during. I don't think so. I think that would a more intense recovery process. So those are the surgeries that I've had, and a little bit about the testosterone. To talk a little bit about the dysphoria, going into all of it, my dysphoria was really, really bad. For some people it's not quite as severe, but for me personally, I remember it was pretty intense. But after, even after starting hormones, a lot of that dysphoria had been alleviated. I think that the top surgery mostly is what really helped the most, and it's different for everybody. But nowadays I notice that my dysphoria is, it's nowhere near what it used to be, and I'm super, super grateful for that. And if you are somebody that is struggling with dysphoria, it's rough, and I know it, but there is light at the end of the tunnel. You just have to be patient. Unfortunately, I had to be really patient throughout the whole process, but it's definitely worth it. Sorry, that was all kind of really information heavy. I guess more about more the dysphoria beforehand, before the actual the transition, the surgeries, the hormones. And I'll be referring to these as insecurities, really, because before I had transitioned, I kind of thought of them as insecurities. It was hard to kind of differentiate between just typical insecurities and things that were really just triggered by the dysphoria, because you don't really know until after you've started hormones and after you have transitioned the things that could be alleviated. Yeah, I guess some of those things were really just a lot to do with with my appearance, you know. Growing up, I was always really insecure about the way that I looked. I always thought I was that ugly friend. I never really saw myself as like somebody that anybody would be attracted to. I should have known back then that something was up because I didn't actually even know about being trans or being trans was a thing until like high school. But I should have known back then because I started dating and like I quote unquote dating, you know, what is a relationship in middle school, but that's what I started doing in middle school is dating. But I really hated it when people would like refer to me as lesbian. And I know I've said that on here before, but I really hated it. It was just like it was like nails on a chalkboard. I never really knew I never knew why. And honestly I never really thought too much into it up until high school. I think that the thing that kind of helped me discover it in high school was I got really deep into YouTube, and I think this is something that most people can relate to, is that, you know, somewhere along the lines in high school everybody gets down this like rabbit hole on YouTube. I guess not really now because YouTube's not as popular as like TikTok and stuff, but when I was in high school YouTube was kind of more of a thing. And I discovered a lot of trans YouTubers on there, and that's when I really started to like realize, I was like, you know what, like a lot of the things that they're saying and a lot of the things that they're doing, like that's me. Like it's hard to kind of explain, but it starts to make a lot more sense. And just that feeling of like somebody out there understands you, it made me feel hopeful, you know? Like, I wasn't an oddball, I wasn't an outcast, because, you know, trying to talk to, you know, at the time, talking to my friends, or even my girlfriends at the time, they never felt the same as me, they never understood me. It was like a breath of fresh air, to be honest. And you know, while I still was dealing with a lot of dysphoria and stuff, and at the time I hadn't known it was called dysphoria or that it was dysphoria, it felt like it just that was like it was alleviating some of that dysphoria, knowing that there was a cure to this. There was a way that I could stop feeling this way and feeling so alone and feeling like I was just messed up from the beginning and that there was no fix. You know, I hated looking in the mirror the entire time growing up. Like, I didn't have any around me. I didn't feel comfortable enough. And I tried to. I really, really tried to like the way that I looked. You can only do so much to make yourself feel comfortable and feel confident enough when you're suffering with your identity, you know? You're not really who you feel like. I've mostly been talking about my insecurities relating to appearances, and that was because a lot of the times growing up, that's what my insecurities were about. It wasn't really until after I had come out as trans that this whole new wave of insecurities kind of hit. Once people start thinking about you and referring to you as a guy, then you kind of like rethink about every single thing that you do. If you're talking to a girl and she doesn't know that you are trans, and you know, she's like talks about something that maybe only women really know about or refer to or have to deal with, like, you know, going to a women's bathroom or dealing with periods or whatnot, you know, and you say something along the lines of like, oh yeah, no, I get that. And then they look at you weird, like, there's no way you get that, you know? It's kind of, then you're like, you catch yourself and you're like, oh shit, no. Like, it's like a jump scare. You're like, oh man, I just fucking outed myself. But you think about that in every single aspect of your life now. Like, you know, the way that you walk and the way that you stand and the way that you talk, even when you're going to the bathroom, like, you think about it, you're like, oh, does it sound like a woman is peeing in here? Sorry if that's too much information, but like, no, sometimes it takes me like forever in the bathroom because I'm like waiting until every single person is cleared out. it really, honestly, like, it's something that I'm sure that every single trans man deals with as well. But when you're just in there and you're alone, like, with your thoughts, you're like, oh fuck, like, every single thing I'm doing is giving me away. It's constantly trying to pass as a male. Even though, honestly, like, people don't pay attention to those details. Nobody's listening to the way that you pee. Nobody's gonna notice the way that, you stand or anything. It's really not that deep, but in a lot of trans guys' minds, all of that is like coming to light as soon as you come out as a trans man. But these are just kind of things that trans people have to kind of worry about because honestly, in lately, especially, they're like, we're just trying to kind of blend in for our own safety. There's been a lot of trans hate, especially lately. Just trying to basically make it to where trans people don't exist as a human being anymore. Just taking away normal rights from them, which really sucks. But those are kind of things that we're all kind of dealing with and we're scared for lately. So just blending in is what's best for us in our minds. But not all trans people love to just blend in. Sometimes trans people are more comfortable talking about it than other people. Personally, I don't really talk about it all too much outside this podcast. When I'm asked about my gender identity, I just refer to myself as man, like as a man. I don't really say, "Oh, I'm a trans man" or anything like that. I pretty much keep that to myself. Other than talking on here, my friends and family know it about me, but I don't really broadcast it too much. But I understand other trans people who do, that are more comfortable talking about it and are more open about their gender identity and their past and everything. There's nothing wrong with that. There's nothing wrong with talking about it. A lot of them want to make a difference. They want to make it more comfortable for other trans people who may not be as comfortable talking about it. I guess sort of this podcast is my way of doing that. I don't necessarily talk about it in just day-to-day life, but on here it's a bit more comfortable to talk about. When you're filling out those applications and whatnot, and they ask, are you a man, a woman, other, I usually just put male. I've even had it to where they ask, do you identify as a trans man? I'm like, no, I just identify as a man. I don't really see why you guys need to know all of that about me, but maybe one day that'll change. Maybe one day I'd be more forthcoming talking about it, but as of right now, I think just for my own safety, I keep it more personal, more to myself. As well as, I don't necessarily let that aspect of my life define me. I don't want people, like, thinking less of me and whatnot. I mean, I don't want to sound like a douche when I say that, but, people use anything to not take you seriously, and I don't really want that to be a reason as to why somebody doesn't take me seriously, especially referring to jobs and opportunities. But I'm pretty honest about it to the people that I like to keep around me. I'm pretty open about it, just friends and family and whatnot. I figured if they don't accept me for who I am, if they don't like that about me, then they're probably not people I want to keep around anyway. So, but as far as jobs go, I'm probably not going to say too much about it. But I understand other people who do. Like, that totally makes sense. I think that beside the fact that people have been hating on trans people, that one of the biggest struggles that trans people face is finding resources. There's not a lot of resources out there, specifically like in states that are I don't want to make it political, but like Republican states, they're really hard to find resources for your transition, whether that be a doctor that will prescribe you hormones or surgeons to do the surgeries that you have been like trying to get, as well as just psychiatrists that are specialized in, trans care. So it's been getting better, I guess. Like here in Indy, we have a doctor downtown that specializes in trans, care. It's part of the hospital that they've dedicated an entire section of that hospital to trans patients. So they do their best at, knowing and understanding and trying to answer questions for the trans patients, but they're still lacking in some departments as far as having enough people to actually operate and run that section, because there's such a large number of trans patients, and then they have a very limited number of doctors. So it is nice to have that resource there. If you're located in Indy and you're looking for resources, my best recommendation, if you're under 18, Riley Hospital, and if you're over 18, Eskenazi. That's really all I can recommend. But I don't know anything outside that. But I know, and I've talked to a lot of people. I have a lot of friends that are also transgender outside of Indiana, and they're Texas, Tennessee, Kentucky. They're running into the same issues as far as just not having a lot of resources that they can access, and getting hormones. Even for me, it's rough sometimes because it's a controlled substance, so it's not like you can get several months at a time. And they've been cutting back on that a lot more recently too. They've been saying like, oh, like we're having more problems with people abusing these, so they've been locking down more on it. So you can't even get the 3-month supply; you have to get it month by month now. As well as like cutting down like how big of the bottles that they'll give you as well. We only get the 200 milliliter bottles, so that'll really only last you like one or two draws. Then you have to go to a whole new bottle. It's kind of wasteful, but it's what we've been told that we have to do. The pharmacists kind of sometimes look at you funny, and you don't always love going up there and saying, oh, I need testosterone, because they immediately know. And some of them are really cool about it, but I've had other ones in the past that have kind of looked at me funny or been not as willing to give it to me, and I'm like, it's not really your decision, man. It's my prescription, and I'm going to be on it the rest of my life, so you can make it difficult or we can work this out. But I found a pharmacy now that works with me the best they can, and they're really cool about it, and now they let me know if I need a refill, because that's another problem, was that they weren't doing auto refills. They just said that since it's a controlled substance, that's not really something they can do. But I guess now they're sending me messages letting me know, hey, you need a refill here soon. So it's helpful, especially because I'm super forgetful. But yeah, these are kind of things that I never really took into consideration when I first started transitioning. Not that would have stopped me or even really had an impact, but it's not really something that you think about, that it's going to be a constant battle. I've been kind of fortunate because the resources I have had around here have been really geared towards trans patients, so they've been really helpful. Whereas I know that in other states, not too far from here, that it's a lot worse. It's a lot more chaotic, a lot more hectic. I've heard about trans people, maybe getting doctors that don't really know anything. Like, they try their best, but they don't really know a whole lot about it, and they get their dosages wrong, and it's kind of dangerous for the patient. So, if you are in one of those scenarios where you're meeting with a doctor that may not be as as familiar with trans patients, make sure you're doing your own research, because it can be dangerous for you, and the doctor may not even know it, as far as getting your hormone levels right. More is not always better as far as testosterone goes. You just need a dose that's right for you. So you don't want it to be like up in the highest range that you can possibly get. It can be a bit dangerous for you and your heart and your safety. So yeah, I'm pretty happy that I'm at a good level here now, and that I've been getting some good care where I am now. I do plan on in the future hopefully getting bottom surgery. The resources for that as well is pretty limited. There's not many surgeons here in the United States that do the surgery, and even less that are trusted, I guess you could say. I guess a lot of the ones that perform the surgery are outside the United States, and so I don't know how comfortable I am traveling outside the United States to get a surgery, unless I was living in that location, just so that I can meet with the doctor if need be. The bottom surgeries for female to male is what I've heard is a lot more intense than it is for male to female. So it requires a lot more precise or precision. It's a lot worse of a recovery process, and it's a lot more expensive. I'm waiting a little bit on that, but just because I'm a little nervous. But I do plan on hopefully one day, and I think I'm opting more for phalloplasty, but it's still up in the air. If anybody's ever interested in the more detail on the difference in phalloplasty versus metoyoplasty, I guess I could do a short segment or an episode talking about it, just what I know and just what my research has told me about it. So if that's something that interests you, just go ahead and comment or message, and I'll be more than happy to tell you what I know. Which isn't a lot, but it's just what my research has been. And I have talked with doctors and surgeons in the past, so I can tell you what I know from that. I guess that was just sort of my experience with my transition. Overall, I feel like it's gone pretty smooth, and it could have went a whole lot worse, and I'm happy where I am now. My dysphoria, it's not completely 100% gone, and, I don't think that it ever will be, unfortunately. But it's at a comfortable and manageable level, so I think that for the time being that I'm happy where I am.
Today we are going to be talking about our kind of low points and what kind of we were going through in specific times of our lives, especially when it comes to being queer, and for me, being bullied for being a gay male, even maybe when I didn't know it. So my high school life was kind of different, and I'll even start in middle school, where I wasn't very popular. Like I've talked before, I didn't feel like I had much free time really in my home life, and I didn't have much free time to devote to different activities at school. So in 8th grade, I became involved with the FFA, which, for those who don't know, stands for Future Farmers of America. If you are an insider, you know that it doesn't stand for Future Farmers of America anymore, but that's what I tell people. And it was honestly a really, really great experience for me. It got me able to, kind of be my own person, get involved with extracurriculars, get involved and meet other people. And it was a really great external activity and social networking activity that really, I think, formed actually my personality to this day. So I'm grateful for the FFA. So I started that in 8th grade, and then in high school, I started getting involved in more and more slowly as the years went on. It was kind of my sophomore year that I started adventuring out into different activities of school. I never felt like I was being bullied in elementary school. So kind of to throw it back a little bit to elementary school, I don't really have any memories of being bullied. I kind of was able to... all my friends were girls, so externally from other kids, it kind of looked like I really got along with, girls, and was able to kind of play up this, straight part. All my family would ask me if I had a girlfriend, and which is disgusting that you're asking an elementary school kid that, but that's what happened in elementary school. And I think a lot of it actually I'm probably blocking out and not remembering, because as the years go on, as I start to unpack things, I remember different obstacles and even opportunities that I've had presented to me. And elementary school was kind of just like a meh period. I felt like I was really overwhelmed and overstimulated at home. So at school, I really just forgot. I don't really remember a lot of elementary school. And then middle school, as I kind of said, I started gaining kind of my own footing. And in the beginning 2 years, they were like 6th and 7th grade. I barely remember anything. So, I mean, really, it was, I don't know what age you are in middle school, but it wasn't really until 8th grade that I have like actual memories of truthfully anything. I swear I don't even remember my 4th grade teacher. I've been trying to rack my brain for years, and I just need to pull a yearbook, but I don't remember my 4th grade teacher. So I think anything before 8th grade, I really, really kind of blacked out of my memory, and I don't know if that's a good or a bad thing, and I don't know how to unpack that. I don't know if it's because of some sort of trauma that I experienced, but I don't know. Hopefully, I'll be able to unpack that via therapy or kind of just time. But in 8th grade and freshman year, I remember I remember vague experiences of, being bullied and, physically harmed isn't sounds a little severe, but, being pushed down in the hallways, just being kind of like shouldered or knocked over. I don't remember kind of a lot that went on, but I do remember a couple of experiences. And honestly, when I hear about other bullying experiences from other people, I wasn't severely bullied, but I did experience quite a lot of it. And unfortunately, I don't know if it's unfortunately or fortunately, but a lot of the kids where I grew up were it was a lot of like verbal, and I would say sometimes to the point of assault, like verbal assault. I think that there were a lot of disgusting and cruel things that were said to me, and I'm only talking about like 8th and 9th grade, really, of middle school and high school. And again, I've blacked a lot of that out in kind of my memory. Probably for the best, because who wants to revisit that? But I mean, kids would get in, or my peers would say things just like about being gay, the F word, like I said, just being pushed down. And one memory that I remember vaguely was just like this kid like walking straight for me, and I was like, oh fuck. And he just like, I had all my books in my hand. I would always try to carry books in my hand. I don't remember why. And he like was coming straight for me, and he just like shoved me down on the ground. My books went everywhere. Everyone's just kind of looking at me. The kid keeps walking, like doesn't really recognize me even really. Just pushes me down and knocks my books all over the hallway. No one helped pick them up, but I had many experiences with that same kid, so I know it was kind of premeditated, and he meant to do it rather than just being like, oversight. And I don't really know how that has affected me. I think it shaped my outlook on life at that point. I've talked about it a lot on the podcast, but starting maybe freshman year, a little bit of 8th grade, I started getting depressed and anxious and all of those things, and it felt like a pretty low point for me. I was not feeling like myself. There were, there were things, like physical things, that you could tell that I just wasn't being myself. And that's why we need to train kids and train teachers and train mentors of like what depression and anxiety and mental illness looks like in someone. I was in 8th and 9th grade, and I was wearing like men's extra large shirts, like for no reason. And I think maybe oversized shirts were the style, but like I would take it to the next level and think that I kind of was really by myself and being swallowed by the environment around me. So I portrayed that in my clothes. I think that was a huge factor. And I would wear cargo shorts that were 12 sizes too big, and all of those things really you could just, there were signs that you could tell that I just was at a really low point in my life, and I would just stay in my room. I wouldn't really converse with a lot of people. I think that was a switch in my life where we started getting into social media and all of those things. And there was I had a core group of friends. I think I've talked about them before. There were four of us, me and three others. The three others were all girls. They were my really great group of friends in high school. We kind of started bonding in sophomore year of high school and became really great friends those 3 years. And then have started falling off, and I haven't really talked to them in months. I remember we would always laugh about this kind of like Facebook memory and Facebook post, and of course, I think laughter is truly my key of healing. But like I look back on it now, and it was a point of bullying, and I was actually dating one of my friends that was in my really good friend group, and this was maybe in 6th or 7th grade, and I think we were dating, and the two other girls in my friend group were like kept commenting or kept telling her that he's gay, you don't want to date him, blah blah blah, he's gay. And so she broke up with me and said it was because I was gay. And I never said that. I didn't even know what gay was at that point. And I think it's like some sort of like psychological paranoia or torment that really struck me in those primitive years of my life. That again, I think that's why I blocked them out. I didn't remember that until it came up in my Facebook memories. Like, how crazy is that? And I remember I would post things on Facebook and Instagram, and this was like probably in middle school, and it was just like, I'm not gay, this person can back me up, I'm not gay, I do this, shit like that. It's like I didn't even know what gay was, and people were just calling me that. I didn't know what being gay was. It just occurred because everyone was calling me that at school. Like, I don't know if that's actually formed the way I am today or what. So that was a huge low point in my life. In high school, sophomore through senior year of high school, I actually, as sad as it sounds, I started to become a really popular person. I started becoming friends with all of the popular kids. I fell into the crowd. I started to almost become the people that were bullying me. I think that's something I really regret. I think it actually got me through my mental illness. Like it helped me cope with my mental illness. So I'm grateful for that, because honestly, I think if I would have stayed at the trajectory that I was at in 8th grade, that I probably wouldn't be here on this earth. At that time, it just felt hopeless. And those popular kids that I started becoming friends with actually helped me find myself. And actually, once I started coming out and once I started just acting myself and being myself, more so myself, people accepted me. And I think I was playing a part a bit of like the stereotypical GBF or gay best friend, because that's what people wanted. And that's not me at all. I'm not that person. So I've done a lot of growing up since then, but falling into that crowd actually really helped me through those bigger years in high school. And I started becoming bullied less because people knew my name. If I were being bullied, I would have said something. I became more outspoken. I would become really good friends with teachers, and the girls that were my best friends, the people that were bullying me were their boyfriends. So, they weren't going to let that happen. And so I think it saved me. It really did, as sad as that sounds. And looking back on it now, I don't like who I was, and I don't love the people that I became really close with. And I'm not talking about the group of the four of us. I just think I wasn't myself. I felt like I always had to be on, which really bogged down my mental health and my mental illness. And I felt like I had to play a part, so to say, which didn't help. And unfortunately, playing that part made sure that I wasn't bullied. So of course I'm going to do that. And, of course I'm going to, fake it till I make it. That's kind of like it. Looking back on it now, that's what I felt like my motto was. When I was coming out, it wasn't on my terms. To both my family and to my friends, I was outed. To my family, I was actively, I think this was maybe freshman or sophomore year, I think sophomore. I was actively participating on the app Grinder and talking to people, and one night I was showing my mom something on my phone, like a picture or a post or whatever. I was showing her something on my phone, and I had a Grinder notification popped up, and it said top or bottom, and my mom was like, "What is that?" And so I ran to the bathroom frantically, started crying, ran to the bathroom, locked myself in the bathroom for I don't know how long, came out, and then, sat down with my mom and just kind of explained my headspace and things like that. And she was somewhat accepting at the time, just more confused. And as for my friends, I was outed. I confided in a really, really good friend that I thought actually shared the same experiences that I had. And he chose to exploit those experiences rather than keep them confidential. So when I came out as gay and told him, he decided to share that with all of my friends and everyone else. So I was outed to everyone at the same time, and it was really, really, really hard to kind of be this different person all of the sudden. It was almost like a saving grace, you might say, because who knows when I would have come out, who knows when I would have done that. And honestly, looking back on it, I'm more grateful for it because I was at that point where just saying the word gay was never going to happen. It disgusted me, to be quite frank. I hated the phrase, I hated the term, I didn't want to identify with it. And I honestly, even until maybe senior year of high school, I wouldn't even say the word gay. I would just say, I like guys, I like dudes. And, that's from years of, being called gay down the hallway, being called a faggot down the hallway. I think it was a trauma response, really, from the things that I had dealt with in the past. And so unfortunately, it wasn't on my terms. But maybe fortunately, I am pretty grateful for it to this day because it helped me push me over the edge, unfortunately. It pushed me over the edge to kind of identify and be myself, even if I didn't want to do it or didn't have the courage to do it. And then with my family, it's hard for my mom to keep her mouth shut. So also a lot of that wasn't on my terms. There were some people that I had asked for her not to share it with, and she did. There were some people that I asked her to share it with, and she did. And then there were some people that I had to come out myself to, which is my dad. But I was really grateful that I experienced a lot of support. My mom was pretty hesitant and confused at first, but when I came out and she understood that I wasn't changing, I was actually being more of myself, she was really supportive, and to this day is extremely supportive of Miles and I. All of my grandparents are extremely supportive. Extremely supportive. My dad is extremely supportive from the get-go. He never cared, and he acted exactly how parents should act. It was nonchalant. It was awesome. I'm here if you need me. Let's go get something to eat. I have 2 great grandparents still alive. One of them doesn't know because she's getting older, and I have really great memories with her, and I don't want that to be tarnished from this. My other great grandmother does know. I didn't tell her. Someone else told her. One of my cousins told her, and she decided to type me a letter on a typewriter telling me that I was going to burn in hell and telling me that I need to change and repent, basically. I was quite upset by that because I had many fond memories with her as well. I was disappointed that, someone wouldn't love you based on that. And I've now not seen her since, which is on her, not me. So that was kind of one of the biggest with my family that really was a low point when coming out. was one of my great grandmas. But I was really blessed and fortunate that mostly everyone else in my family is and was extremely supportive. And now it's much more common. I've got like a cousin on each of my mom and dad's side that's identifies as part of the queer community, and my sister. We're really fortunate there when it comes to family who is supportive. Friends on and off. It's hard to find friends that don't see you as a gay best friend and see you as a human being. I have had to unpack that a little bit, and I'm just at the precipice of that, but I'm unpacking that currently of what a GBF is and how it's celebrated in our society, and why that's one of the only reasons that being gay, white, cisgender male is kind of the norm when it comes to LGBTQ plus, and why that's one of the most accepted. So I've been unpacking that about how a lot of my friends from high school, that's what I was considered, whether they'll admit it or not. And I don't want to be seen as that person anymore. I want to be seen as a full-blown individual that has feelings and is a person rather than just being the life of the party. As sad as that sounds, but that's kind of what I was considered, it felt like sometimes, which kind of leads me into finding my own true friends and the people who stuck by me and accepted me. A lot of it changed when I graduated high school. I met Miles. When it comes to my undergraduate, my freshman year was at a different university, and I don't even talk to anyone from that university really anymore. When I transferred, that's when I really fell into my own of going to get an art degree and being with the people who were considered weirdos, and that's where I truly felt accepted and I felt myself. And I met Miles when I was at that first year in that the university that I did right out of high school, and he really changed my outlook, and I relied on him heavily. Obviously that's an intimate relationship rather than just a friendship, but he is still my best friend, and has been my best friend since I met him. So I consider him a friend, and I also consider him my fiance. So he really helped me get out of that mindset of feeling like I have to rely on others. Now we did develop a very codependent relationship, but we've since worked through that. He helped me identify that I was my own person, and there were people out in the world that would love you for just being you. And he was truthfully, and I'm not joking here, was the first person out of any friends or family that I felt like I could be my whole true self with. I know that sounds crazy, but he really was, and I'm really grateful for that. I would consider him like my first true friend. Obviously, it developed more, and we fell in love and are still in love and things like that. But he really, I wouldn't be the person and the fully realized individual that I am today without him. And frankly, I know I've said this before, but I probably wouldn't be on this earth if it weren't for him. So extremely grateful for him. And then as I transferred to the getting an art degree and being with the more creative individuals, I found my now best friend, Greyson. Hey, Greyson. Who is the co-host of this podcast. He is the second person that I think truly loves me for no matter what position I'm in, and will let me say what I'm thinking and understand me, and hear me out. And there's very few people in the world that will do that. And luckily I found two people, Miles and Greyson, that I feel like get me and understand who I am and see me as a person rather than using me for maybe my certain characteristics. Loving I think I can dumb it down to like just loving your full self, and no matter what state that is. I'm lucky to have people in my life that I can say that and identify with that statement. And then lastly, there's one other person that I feel like I can truly be myself with, and that's someone who I just met last year. Her name's Sophie, and she's the other person that I think I can truly be myself with and sees me as a fully realized human and loves me for who I am and no matter what state I am. Again, it's really hard to find those people, and it's really hard to see the light at the end of the tunnel, but I went 18 years, the first 18 years of my life, I never really had that person or people that would really, really lift me up. And I never had that person that was always there for me, no matter what. I'm really grateful to have found those people. And, that's another privilege that I have, is having that support group, because I know a lot of people in the world do not have that support. And hopefully, if you're listening to this, you can feel that support from me, and you can feel that support from Greyson, because we're here to give that to you. And I hope that we can get to a place, as a community, as a queer community, we get to a place where we have the support we need, because unfortunately, us queer individuals, more likely than not, fall short in the support category.
Thank you for listening to this podcast, and if you have any questions, go ahead and message us, and I'll be more than happy to tell you what I know. Sorry that this episode's been a bit different than other ones, and less of a Brent and I talking together and more of a just you hearing from him and hearing from me. And I appreciate all you kind of being flexible with us and making this work for us. Thank you so much, and have a great day.